You may be surprised to hear that alcohol accounts for 1 in 13 cases of breast cancer among women in the UK. Now, drinking alcohol does not mean you will get breast cancer, but there is evidence to suggest that the risks of alcohol-related cancers start from about 1 alcoholic drink a day. In other words, there is no safe limit. The more you drink, however, the greater the risks of developing breast and some other cancers. So for each alcoholic drink you drink every day, you are increasing the risk of developing breast cancer by about 7 to 11%. Of course, alcohol isn't the only factor. There are other things that cause breast cancer, sometimes just bad luck, and some we just can't change. That includes getting older. Family history, of course, does increase some women's risk of breast cancer, but actually probably only 1 in 10 breast cancers is down to genetics. Being overweight and a high-fat diet, both of those can have an impact too. Having more drink-free days is a really easy way to reduce your risk. So what should you be looking out for? Well, if you're thinking about being breast aware, it's all about knowing what's normal for you. Get into the habit when you get into the shower, having a look at your breasts after you've taken your clothes off to get into the shower, or maybe feel them regularly when you get into bed. First of all, start with your arms down by your side and have a look at your breasts. Do they look the same? Are the contours normal, or is there an area where it looks as if it's being puckered, as if it's being pulled in from the inside? Then have a look at your nipples. Is one of them turning in for the first time? Is there any discharge, especially if it's bloodstained? Or is there dry skin or areas of the skin where the skin looks dimpled like an orange? And finally, of course, feel. Use the flat of your fingers and get into the habit of feeling all over your breasts, and go all over them, including right up into the armpit, because you've got breast tissue there. If you find anything you're concerned about, do not hesitate to go and see your GP. And of course, if you're invited for screening, please do think seriously about attending.